Hello, I'm Dan Brown. You're watching News at 10. Today I'm joined by my co-host, Misty Summers.
Hello, Dan. Pleasure to be here.
Tonight we were talking about ADHD. What is it, and how can we help those who have it?
Coming up at 10:30, we will have an interview with a woman who was eaten by a bear and survived.
What is ADHD? We've all heard of it. All of us probably know someone who has it, but what is it really?
ADHD stands for Attention Deficit Hyperactive Disorder. It is a chronic disorder, and there is no cure. ADHD often begins in early childhood and can last through adulthood. Medication and treatment can help, but the disorder is typically lifelong.
The symptoms of ADHD often appear as hyperactivity, impulsivity, and inattention. Even though hyperactivity will reduce with age, the other symptoms often last through adolescence and adulthood.
What causes ADHD?
There are a few factors that increase the risk of having ADHD. The biggest factor is genetics. Usually ADHD runs in families, just like many other disorders. Substance abuse, while pregnant, and exposure to toxins can increase the risk of this condition. Brain injuries and low birth weight are also considerable factors.
It is more likely for males to have ADHD than females. The prevalence of children diagnosed with ADHD is only going up. The prevalence raised 42% between 2003 and 2011. 1/3 of children who are diagnosed with ADHD retain their diagnosis into adulthood. The more severe symptoms of ADHD are, the earlier it is likely to be diagnosed.
But how is ADHD treated?
Like many disorders, ADHD is often treated with medication. A study published in 2011 reported that 69.3% of those with a current ADHD diagnosis received medication to treat their symptoms. Medication is one of the most popular treatments. Stimulants are a type of medication that is used to treat ADHD. Children who took stimulants reported between 80% and 70% of a decrease in their symptoms. Non-stimulants can be used to treat ADHD. While they are slower acting, they can stay in your system for up to 24 hours. Using medication to treat ADHD can be controversial with many parents. It can be very scary to put a child on a stimulant. However, there are often positive results and decreased symptoms with the use of medication.
There are many other treatments for ADHD. A few examples of alternative therapies include talk therapy, cognitive behavioral therapy, counseling, anger management, and applied behavioral analysis.
How can we help those with ADHD? What can parents and teachers do?
There are many scientifically proven educational interventions for students with ADHD. It is important to remember that no one intervention is universally helpful for all students. It can be helpful to split directions for projects into steps. This helps the student to focus on small steps instead of getting distracted or overwhelmed by a large project. Students with ADHD are often allowed to take more breaks than their Gen Ed peers. This helps them to stay on task and keep from getting distracted. They can also be given more time to take tests, as processing information often takes longer for them.
Most importantly, be patient and kind to those with ADHD. Coming up, we have an interview with an adult who was diagnosed with ADHD as a child. How has having ADHD affected your life?
So for me, it's mostly hyperactivity. I have a lot of energy. No one knows where I get all of my energy at any point in time. There's been some intention stuff that I've had to deal with throughout childhood, which got better as I grew up. I learned how to cope with that. So now I'm just very hyperactive.
What symptoms cause you the most difficulty?
Attention is is the big one.
Did you ever have a teacher use an intervention with you?
Not that I really know of. I didn't know how school worked as a kid, so I'm sure they did. I'm sure there was a bunch of that, but I wouldn't have known because I didn't know what school was like for anyone else.
What treatments have you tried?
We've tried many meds with me. Ritalin I took for a long time, which is a pretty popular one. And I never ended up on Adderall. I think I'm allergic to Adderall, actually.
What worked best for you?
Best for me, Ritalin worked real well for a while, but it was better for me to eventually get off meds and learn how to cope with focus and use some of that hyperactivity for something productive rather than just running circles around everyone all the time.
Is there anything you feel people should know about ADHD?
ADHD is very normal. I think a ton of people have it. And it's just okay to have. Work with it and you'll figure out how to hone in the hyperactivity. And
how has your ADHD changed from childhood to adulthood?
As a kid, I was real annoying, and I had way too much energy, and I still have too much energy, but people like me now, so...
Thank you for sharing your story, Andrew. We'll be right back after the commercial break. Up next, we have a woman who survived a bear attack.